Good morning. Thank you so much. It's a pleasure being here. Excellencies, colleagues, dear friends. Universal health coverage is a decisive factor for pandemic prevention, preparedness and response, and achieving UHC requires mobilizing sufficient, particularly domestic financing and joint efforts of all actors. And I therefore thank Japan for its leadership in advancing these crucial topics and convening us here today, from the Medical Countermeasures Delivery Partnership to the III initiative. In light of the challenges we observed during the pandemic, we must improve access to medical countermeasures, such as vaccines for everyone. The pandemic accord will be crucial to this end, but we also need to remain vigilant while negotiations are ongoing. The next pandemic could hit us anytime, and we need to be prepared to respond quickly and to ensure that nobody is left behind. And Germany therefore supports calls for establishing an interim mechanism and commends the leadership of Japan, India, South Africa, and Norway to this end. The Medical Countermeasures Delivery Partnership should be a key component of such a mechanism. We are committed to quickly turning into practice, and we will continue to contribute our expertise from the German Last Mile initiative. During our presidency of G7, we have provided 850 million euros to support countries that were struggling to turn vaccines into vaccinations. Our particular focus was to reach underserved and vulnerable people. We, for example, purchased cold storage, expanded routine immunization, and supported local vaccination campaigns in over 50 countries. Through these measures, we also contribute to building capacities and strengthening health systems in the long run. And my dear friends, we all know that strong health systems and primary health care are crucial preconditions for UHC and achieving the 2030 agenda. And this is why sustainable financing for global health has never been more critical than today. According to the World Bank, the financing gap for universal health coverage is estimated to be $176 billion in total by 2030. Domestic financing or traditional development assistance alone cannot close this gap. Leveraging private investment is therefore key, and impact investment is a crucial vehicle to reach that goal. Germany therefore welcomes the Impact Investment Initiative for Global Health, spearheaded by Japan. Germany was an early adopter and pioneer of impact investment funds in health and played a major role in shaping the ecosystem. Germany was also a seed investor in the Global Health Investment Cooperation to finance funds with social impact and financial return, such as the Global Health Investment Fund in 2012. Having since then contributed 50 million euros, we have thus seen the positive effects of impact investments and look forward to bringing our expertise and experience into the III for global health. My friends, only together we can make progress and achieve a healthier and safer world. Germany will play its part and take its responsibility. I thank you.
Cliff, thank you and good morning. And firstly, let me thank the government of Japan and the Japan Society for convening this session today. And I'm delighted to be here representing the UK government. Before coming on to the III initiative, I'd like to welcome the work being taken forward on medical countermeasures, which was discussed in the last session. And although the value of MCMs goes beyond health emergencies, the pandemic brought into sharp focus why research and investment in them is so important. It's very much part of the work that we're doing domestically in the UK, but also part of our global health agenda too, as we set out in our new global health framework, which launched in May of this year. The context of our work on smarter and more impactful investment in health is not only about universal health coverage, but our broader collective efforts in attaining the Sustainable Development Goals by 2030, which we know are off track in many areas. Now, many countries face a difficult outlook of increasing debt and constrained public spending, while financing gaps to meet universal health coverage remain vast. The private sector can, and indeed should, play an important role in helping countries invest in equitable and quality healthcare. However, as recent reports have demonstrated, there is much more to do to ensure that investments flow into the right areas where they can support equitable access to healthcare, especially at the primary level, support the production of pharmaceuticals, or support government systems with laboratory capacity. We therefore warmly welcome the Japan's G7 presidency's initiative to drive more and fairer investments in health that supports countries' national priorities. And we strongly believe that sharing lessons and best practice is critical if we're to develop our understanding of the right focus areas for investment. Now, our development finance institution, the British International Investment, is also engaging constructively with the III through the Investors for Health initiative, which brings together DFIs and investors globally to determine best practice on health investing. And this includes sharing best practice of driving innovation through MedAccess, which was set up by BII in 2017. And in the last 5 years, over 375 million people in more than 90 countries have benefited from MedAccess's agreements to improve access to life-changing medical supplies at an affordable price. So, for example, MedAccess helped ensure 7.5 million more children will be vaccinated against malaria, averting 8.7 million cases of malaria. So my thanks again to Japan and for all the partners for their engagement in this hugely valuable initiative. Through our collective efforts, I believe we can harness the investments we need to make in health in a way which is equitable, sustainable, and aligned to our national priorities. Thank you.
Hello, everyone. It's nice to be here today. First, thank you, as everyone has said, to the government of Japan for their leadership and for the organization, Japanese organizations supporting us here today. So many of you may know Leapfrog Investments. We are focused on supporting emerging consumers across Africa and Asia with essential services. So we focus on financial services and healthcare. And we're really excited to be part of this collaboration because, we believe in public health systems, but we believe there's a role for affordable, quality solutions from the private sector. And I'm delighted that one of my colleagues is here today from Redcliffe Labs in India. So a couple of examples of how intentionality in healthcare can deliver results. So Redcliffe Labs is one of our partners, and we've worked with them to deliver more than 4,000 diagnostic tests across Africa and India. And also, we've been working on a lot of quality pharmaceutical delivery throughout East Africa. So we're just delighted to be part of this coalition. We know when the private sector and government come together with local communities, we can have great results. Thank you very much.
Thank you. Thank you very much for this opportunity to talk about ASA's initiative for global health and impact. So I'd like to have my slide. Slide one, please. First slide. Okay, next. So we are aiming to realize social good with efficiency. And as stated here, the Japanese government recently announced their idea of a new form of capitalism. They recommend the industry to tackle social issues together with the public sector and such companies will be rewarded in funding and the gathering of people. I think this is a very good proposal by our government. In ESA's case, we define such three social issues: relieve people's anxiety over health, reduce health disparities, and realize empathy with patients. Simultaneously, we would like to achieve those goals with high efficiency. What is efficiency in this case? I would point out four such efficiencies. First is raising funds, capitals, at reasonable cost or at lower cost than usual. Towards this, we recommend further to open impact stock markets in major stock markets such as in Tokyo, New York, London, or Frankfurt. In terms of talent, we have a lot of talent interaction, not just business and academia, but also global organizations and NPO, NGOs, particularly in the area of global health. Multi-technology adoption is quite important these days, and I like to emphasize the significance of digital technology, data plus AI, and remote technology, particularly in developing areas where there is basically less infrastructure. Lastly, business model. A commonly used one has been PPP, public-private partnership. But here, we are recommending ecosystems as a business model, which shall create database solutions and more clear ownership and accountability. Next slide, please. I touch on two of our cases, try to quantify the impacts of our business. One is for NTDs, neglected tropical disease, particularly lymphatic filariasis. We've been providing DEC tablets, DEC tablets, one of the major treatment drugs, free of charge to WHO since 2013. The amount now has reached to over 2.1 billion tablets. We calculate the impact of those activities into monetary terms using the impact-weighted accounting method. Firstly, we define the number of people who have benefited from our drug in the cases of preventing the infection, stopping disease progression, and reduction of frequency of acute and chronic symptoms. The lifetime value of DEC tablets, DEC tablets contribution is calculated through multiplying the number of working days recovered among those people who benefited by the minimum wage, plus medical cost offset during average life expectancy. The lifetime value was reached $60 billion and the annual impact value is $1.4 billion per year. On the right side, we show the case of the most recent drug, Leqembi, for Alzheimer's disease, which has been approved in the United States. We calculated the impact in the US community in monetary terms. Look at this equation, maybe bottom part of the slide. Corey gained times willingness to pay threshold plus cost of offset divided by times on treatments, which equals annual per person value derived by Leqembi. For the calculation of Corey gained and cost offset, we apply a disease simulation model, which could calculate life year, quality of life, and cost of offset. The result is that the drug delivers value equivalent to $37,600 per year per patient in the US community. Next slide. So this is my final slide. Industry performance evaluation should not just respect only financial parts represented by indicators such as ROE, return on equity, but also include impact evaluation, such as the impact on equity and impact on cash. Thank you very much for listening.
Great to see you.
Thanks very much. And I'd like to thank very much the government of Japan for the leadership shown not only on the III initiative, but also the Medical Countermeasures initiative. It's really important for all of us. As the minister mentioned, MedAccess is an investing company set up by the British government through British International Investment. We have $200 million of capital, which we invest purely on the target of improving access to affordable medicines. And we know from the report published by the WHO and World Bank yesterday what an enormous gap we have in the world in terms of people getting access to health care. Even before that, we knew WHO had estimated there were some 2 billion people in the world who are unable to get access to the basic medicines they need. So MedAccess works, we provide finance, concessional finance, to bridge the makers of products and the buyers of products. And we do that by partnering closely with business to help to de-risk the business venture of bringing new products to market at lower prices, faster pace. So Bill Gates, when he was up here earlier, he mentioned that the dual action mosquito bed nets for malaria, before they could be brought to market, the price had to be brought down. So MedAccess did that, and we joined the Gates Foundation in reducing the price of these new malaria nets by 40%. And we do that with a number of companies on diagnostics, on treatments, on vaccines. And I think a core principle is there are many companies in the world which produce terrific products. They want those products to get in the hands of those who can use them. That is their core function. But it's often difficult to do so because the commercial risks are too high. And some catalytic finance can really help them to achieve that. And that's what we're about, and look forward to working with all of you on advancing that agenda. Thank you.
It's lovely to be here, and thank all of you who are still here. It's been a lovely morning. The DFC is the United States International Development Finance Corporation, and we are the United States government's development finance institution. We have prioritized health since we were created almost 3 years ago, actually maybe almost 4 years now. We were created as a modern DFI, and since then we've invested $2.6 billion in health. We are committed to strengthening health system resilience through investments in health services, manufacturing and supply chain, and technology. We are also committed to ensuring holistic health and well-being through investments in water, sanitation, and nutrition. We know that we cannot do this work alone. This week, DFC joined a group of G7 DFIs and EIB and IFC to collaborate on surge financing, for health emergencies to ensure widespread access to vaccines, tests, and treatments during future health crises. This effort complements the broader Impact Investing Initiative, III, for global health to mobilize more private sector investment to improve not only pandemic preparedness and response, but also broader health system resilience. We are proud to build on this work with G7 partners and want to thank Japan for their leadership. DFC's debt, equity, political risk insurance tools mobilize significant amount of private capital to help innovative businesses improve lives in low and middle income countries. We look forward to building on these investments through the III initiative and to working with our partners, many of whom are here today, to expand investment in impactful healthcare projects, to improve pandemic preparedness, and of course, health system resiliency. Thank you so much for the time.
Good afternoon, everyone. It's a real honor and privilege for us to be here today and share some of the learnings from the Samrit Healthcare Blended Finance Facility that we manage out of India. But first of all, thanks a lot to Government of Japan, G7 leadership, GSG and other partners for launching this key initiative that is a kind of a key requirement in today's time if we have to achieve the global health targets. Samrit Healthcare Blended Finance Facility is a facility supported by USAID and implemented by IP Global, a development sector consulting firm. The idea behind Samrit emerged just weeks before the pandemic. Working with the Government of India, we realized that if India has to emerge out of the pandemic, we have to have the private sector play a key role. The challenge was how to get private sector involved, and that's where the idea of setting up a blending finance facility came. The second core principle was that while our cities, the urban centers would who have the right kind of infrastructure would survive, what would happen to the last mile? The tier 2, tier 3 towns, rural areas where the coverage of health services has always been at a short. So with that kind of a mandate, Samrit began the journey and focused on leveraging at 3 levels. We very quickly realized that if we have to reach to the last mile, technology has to play a key role and innovation has to be at the centerpiece for this facility. The second piece was from the point of view of that one donor, one organization cannot achieve everything. So while USAID played a key anchor role providing majority of the funding, we were also benefited by other philanthropies, including the Rockefeller Foundation, Ford Foundation, Morpho Foundation, and many of the Indian corporates joining the facility. Third, last and but not the least, leveraging the private sector was a key part. From innovators who we were supposed to provide support to financial institutions, the mainstream banks and other institutions, including the DFC, who came forward to kind of structure this facility. We are proud to say today that as we stand, it's a $300 million facility having supported 60 plus healthcare enterprises across the country, reaching to 43 million people across the country, including some parts of East Africa where we have taken some of our innovations now. All this have been only possible because of partnerships. And it's again a big privilege to be part of this global partnership now, because from the learnings of Samrit, we have realized that partnerships play a key role. We are at Samrit 100 plus partners who work together, coming from the government, philanthropies, private sector banks, to innovators that we work with. And without this collaborative working, this kind of achievement is not possible. Just to give an example of the power of blended finance and impact financing, for every dollar of philanthropic capital, we are able to leverage 10 to 15x of commercial capital. As things stand, we have leveraged over $250 million in commercial capital using only 17 million of grant money. That has been the success of this initiative, and that's what we kind of want to bring towards as we partner for the III for Global Health Initiative. As we move forward, we see that learnings from Samrit using the platform of III can be taken to other LMICs to set up similar facilities there. The situation in each and every country may be slightly different, but if we collaborate together, we can easily achieve the outcomes. Secondly, as we move forward, the focus has to also go towards the linkages between climate and health. And that's something we are following up on Samrit, but we also want to see as we grow outside of the country that key focus is there. And all this is going to lead us to the achievement of the global health security agenda and ensure we have universal health coverage earlier than the expected dates. Last, I would just want to say that, again, collaboration is key, and it's great that we are all coming together. 37 partners have already joined in this effort, and we are hopeful that as we move forward, hundreds of more will join together. Together we can, together we will. That's the kind of motto we should work with. Thanks a lot. Thanks for your attention.
Thank you, everyone. My name is Amit Bori. I'm with the Global Impact Investing Network, or the GIN for short. First, I just want to say thank you to the government of Japan for their leadership in advancing the III initiative for global health. We at the GIN are incredibly honored to be able to partner and support the initiative. Our network includes over 460 firms in over 50 countries. They're primarily private sector investors, but we also work with donor governments, with development finance institutions, with foundations, and some leading organizations in health, including the WHO and UNICEF. We see tremendous need and opportunity for impact investment to address global health. Our latest research identifies that over 48% of impact investors are looking to increase their allocations of investment capital into global health over the coming 5 years. We do a lot of work at the GIN to develop impact measurement and management tools to help investors better understand and measure how their investments contributes to the health of people around the world. We're also working to develop impact performance benchmarks to help sharpen investors' focus on achieving the best outcomes. And lastly, we'll be working with our network to mobilize more private investment capital to help advance global health around the world. So I come here with a lot of gratitude and an invitation to all of you who are interested in impact investment in global health to join our network and our partners in helping to see through the success of this initiative. Thank you.
Thanks very much, Cliff, for this, and it's been a really interesting session today. I would just remind everyone that the Japanese government have always played a leadership role when it comes to global health. If you look at previous G7 presidencies and also the G20 presidency, Japan has played a leading role. And indeed, the late Prime Minister Abe created the first joint health and finance ministers meeting before the pandemic. And that has been an absolutely critical initiative in making sure that finance ministers understand that spending on health is an investment and not merely spending. And of course, that's been reflected in many of the communiques. The G20, G7 Health and Development Partnership, which is made up of the private sector, many of the pharmaceutical companies, many of the NGOs who have been here or are still here today, and of course, leading academic institutions, have worked together since Angela Merkel supported its establishment during the 2017 German G20 presidency. And that was the first time that health ministers at the G20 ever met together under her leadership. So some of these things are very new. The reason why we are supporting and strongly supporting, Cliff, this initiative is that philanthropy and ODA on its own is not going to deliver what we need to do if we're going to try and transform our health systems. And what we have to try and do are really three key things. The first, and I was talking to the World Bank and the IMF about this yesterday, at the autumn meeting of the institutions this year, they are going to have to bring in a different regime to manage debt. Because many of the finance ministers I speak to around the world, as I travel around as chair of the G20, G7 partnership, tell me that they can't afford to invest in primary health care. They can't afford to invest in the initiatives to mitigate climate change because they're too committed to trying to service the debt that they have from the IMF. And so the first thing we need to do and recognize is that there must be some change in the way in which the IMF operates its regime. Or frankly, these countries will just go off to China and will look to get the loans from China, with all of the implications that that might have for geopolitics. The second thing is the excellent initiative that was launched by President Macron and my good friend Dr. Tedros, who I think should stop playing football or something because he looked a bit, he was limping this morning, in bringing together the multilateral development banks. And they've come together for to support initiatives for crisis primary health care. And that's a very, very welcome initiative, but it has to be expanded. And then, of course, the third thing, and this is why we are very committed to the Triple I, is we've got to get the private sector involved. And why do we have to do it? Well, I'll give you two examples. Yesterday, I was with the TB community, and they are looking for $60 million to do the third stage trials for a TB vaccine. And where are they going to for it? The Gates Foundation. And Bill and Melinda Gates have been superb. But why haven't we got a funding mechanism so that these essential third stage trials can be funded properly and we can get this TB vaccine out? Because TB is a pandemic. We can get this vaccine out into the community. And also, of course, we've got the crisis of antimicrobial resistance. We've got lots of small biotech companies who are working on tools to tackle AMR, but they can't get their product to market because there isn't the financing mechanism there, and that needs the private sector and it needs governments to step in. And if we don't do it, the next major pandemic will be AMR within the next few years. Finally, I would just like to say, Cliff, that one of the things that the Triple I needs to do urgently, and I'm really interested in what our previous speaker said, is we've got to develop the metrics and we've got to develop the taxonomy so that investors feel confident in investing in health. Now, I do a lot of work on climate change, and we have got metrics And we have got a taxonomy now, developing a common taxonomy for climate change. But we've got to have the same thing rapidly. And I would say, Cliff, to you and to the members of the board of the III, urgently, let's get that taxonomy and those metrics in place, because then we can talk in very concrete terms to the private sector about investing in health. Thank you.
And thanks for not butchering my name. First of all, I'd like to thank the event host, the government of Japan, for their longstanding and exemplary leadership in global health and human security. We'd particularly like to express gratitude to the government of Japan for their continued support on innovative approaches to advancing global health and human security. For example, through the GHIT Fund and the Linked Access and Delivery Partnership, where UNDP works with WHO and public and private sector partners across the research, development, access, and delivery continuum. So I think Japan has always had this vision about really bringing more partners together to advance UHC and human security. I'd also like to congratulate Japan on the launch of the III for Global Health Initiative, which we see as fundamentally linked to the MCM initiative as well. Both of these together can contribute to expanding the engagement of the investment sector in meeting public health needs, particularly around UHC, PPR, and health system strengthening. Fundamentally, this will require, I think, as a number of speakers have said, equitable access to medical countermeasures. And all of this really is to advance health equity. We see from a number of the discussions this week that increased financing for health is a pivotal step towards realizing goals around UHC, PPR, and human security. Given that many countries still face a challenge, including the country that we're standing in, still face a challenge of significant out-of-pocket expenditure for health, expanding this sustainable financing is really imperative. We work with low and middle income country partners on developing investment strategies, improving fiscal policies for greater domestic financing for health. But as you rightly heard, there are many countries in debt distress. UNDP published research this year. We've got about 60 countries ready to go off the debt cliff. Fiscal policies are not going to help them. We need different solutions, and we need the expertise of the investment sector and the private sector really to help with that. We need the IMF and the World Bank to also reform. As a partner of III for Global Health, we look forward to contributing to the initiative, building on our sustainable financing work, which includes SDG investor maps, impact measurement and management services, and we fully agree that we also have to, in this space, look at and bring in investments in climate, because that is really, really ultimately already having a major impact on health systems across the world. Thank you.
So finally, I think we are coming towards the end. And thank you, everyone. Thank you for your stamina and showing your support. And all of this for III, for improving access to health, where it's needed most, using impact, getting those metrics right, moving capital towards healthcare solutions. And if you haven't already joined the III, please get in touch with us. We would be delighted to have more partners.
Thank you for the important conversations that we had. I know that in the room, there is energy that goes beyond what we heard today. There are going to be impacts that go beyond. So thank you for the work you're doing. Thank you for III. Thank you for the work you bring. This is so important for all of us beyond today. So I hope that this is not just a good discussion point that happens once a year at the UN General Assembly, but what we did here in New York today, what was announced by the government of Japan and by all of us, will be brought forward, and that we can continue to be part of that important work. With that, let me give you a very hearty otsukare-sama deshita from Japan Society. Say thank you for all of you.